Parents right now are facing a deadline to line up their kids' summer plans.
As those camps start filling up, the I-Team takes a closer look at a loophole that could put your children's safety at risk. Chris McKinnon explains how one word can change everything.
Right. There you go. Come back, come back.
A chance to improve their skills and have fun is the goal behind the sports camps run by the John Smith Soccer School.
Guys, bring it in.
But that's not the only thing that's important to camp director Felicity Smith-Day.
The health and safety and well-being of our campers is our #1 priority.
The camp follows this 32-page list of regulations issued by the State Department of Public Health.
We are required to do CORI checks, which are criminal history background checks.
The regulations for camps also require sex offender background checks, medical histories for campers, immunization histories for staff, a doctor to oversee healthcare procedures. They even have to have a traffic plan for all of their locations.
The list really goes on and on.
But here's what many parents don't know. Change camp to a 4-day clinic. All that changes.
So what regulations does a clinic have to follow?
As far as clinics, they don't have to meet the regulations because they don't fall under the definition of a camp.
Doesn't make any sense. Why would they have the regulation for everything else, but not for a 4-day clinic?
It's crazy.
Crazy, but true. Lenny Izzo heads up the Wellesley Board of Health. All camps in town have to register with him to make sure they're following all of those regulations. But clinics don't have to check with him or anyone else.
I think it's worth being looked at on the state level to see if there's a gap.
Oh, I think it's absurd.
Jane Newman of Milford says her sons have done clinics and she always assumed the rules were the same.
I'm shocked that these people aren't being quarried and having their whole background dug through. And they should be there working with kids.
There have been some efforts on Beacon Hill to limit what programs are exempt from the regulations, but so far they haven't passed. Communities can pass their own requirements, and some clinics go above and beyond what the law dictates. But in the end, it's up to parents to ask. For the I-Team, Chris McKinnon, WBZ News.